Yeah, this speculum is a much kinder, gentler speculum. When we had the microkeratome, we really had to crank those lids open because we had a lot of equipment to fit on the cornea. Not anymore. Matter of fact, the speculum that we used to use, Dr. Lipsky called it Mr. Nasty.
That's what you're talking about.
Now that's a blast from the past. That's an old RK marker. That's in case the flap comes completely off. Dr. Lipsky knows exactly how to orient it so we know what's top, what's bottom. It's like a puzzle piece. Now that little wire looking thing with the hook on it, that's called a cybel. Remember I said the flap does not exist until Dr. Lipsky connects all those gas bubbles. That's what he's doing right now. He's going around the outer edge, and then the other side of that looks almost like a sickle. See? And he just puts it right under that flap, and he connects all of those gas bubbles. He's connecting the dots. Everything you ever needed to learn, you learned in kindergarten?
Yeah.
Connect the dots right here. Now he's going to lift it up, and you'll see the famous Lipsky fold, as we call it. He likes to fold it in half, like a taco. And if it doesn't fold perfectly, he'll lay it down and do it again. He loves that. And then he's just going to dry the surface. Now he's measuring again, and he subtracts the two numbers to find out exactly how thick the flap is. This is a Lipsky thing. He just wants to know how thick his flap is. Now he's getting everything perfectly centered. You'll see the blinking reticle right in the middle. When Dr. Lipsky starts to treat, that reticle is going to blink very slowly. That's how you'll know that we've started the treatment. Plus, if you listen very carefully, you can hear it. What we're doing right now is we're setting the auto tracker. Remember I told you that the Lasik Star 4 comes with an auto tracker. If Nathan makes little microscopic movements, which every eye does, that's how the eye stays alive. It has to make little micro movements. The auto tracker is following him just as fast as he can look, his eye can move. If he should look too far out of range, the laser just stops. It says out of range. So we never miss a pulse. That instrument that you see down there is called a flap protector. It protects the flap. Can you hear? Now we're going into his astigmatism correction. Can you see how the light, if you look carefully, can you guys see the light, how it's kind of dancing all around? Mm-hmm. That is the customized treatment. And he's done. That's it. Now Dr. Lipsky is going to put the flap back down. And that's just a cannula on a syringe filled with balanced saline solution and an antibiotic eye drop. He's just irrigating all of the microscopic debris, any kind of mucus, any sterile fibers, anything that is on the cornea at this point, irrigating it all out. That's a double barrel cannula. He just kind of steamrolls the whole thing out. And he irrigates some more. Now Amanda's going to put on some Pred Forte, really, really cloudy. Not only is this an anti-inflammatory, but Dr. Lipsky likes to use it as a disclosing agent all the way around the flap to make sure that the gutter is an appropriate gutter. Make sure that there's no shrinkage that pulled the flap away, that it's fitting properly. And now he's just playing. How do we get the flap to seal? Do you guys know? How does the flap stay in place? Anybody?
Do it by itself.
Does it by itself? It does it by itself. There's a pumping mechanism that's exposed when you lift the flap. When you put the flap back down, it just sucks it back down, just like you were to drop a washcloth in the bathtub. Just sucks it right back down. If we didn't have that going on in our cornea, LASIK wouldn't be possible. The flap would just be all sliding all around. People swear that we have to use some sort of super glue or something like that. It does it by itself. And he's all done. Speculum's out. And we switch to the next eye.
So you can see from his right eye?
Yep. He'll notice that the red light that he's looking at is much sharper now than it was when he laid down before.